Our substance use program here at Adventist Health Bakersfield started originally with the California Bridge model, including our MAT services. And then when that funding stopped, we rolled into doing MAT services and substance use linkage here at Adventist Health on our own through the hospital for our community.
I grew up in Bakersfield. We're an agricultural town. So we've got all these surrounding areas. There's not a lot for people to do. So I was still bedside when we rolled out substance use navigation and specifically some of the programs associated with MAT. It can be pretty chaotic in the emergency department, but our teams have learned over the years that prioritizing these patients is critical to helping them succeed in the world of addiction. It's opened up this huge door for people to come through and get the treatment that they need.
If they've used in the past 12 hours, we're not going to dose them, but we're going to get them a prescription. We're going to make sure that it's sent to a pharmacy where it can be filled, and then we're going to set them up with linkage care for those MAT services to continue in the community.
To prioritize a patient in an emergency department, you're always going to go to your most critical, right? So an overdose is a critical patient. They're in a setting that is safe and medically appropriate. So we can help augment some of the treatment by giving them other things to help them get through those first phases and then add the buprenorphine to it so that they don't have that precipitous withdrawal effect. This could be the very moment that makes or breaks their decision in choosing recovery as opposed to continuing use.
I do always remind my patients, hey, here's a month-long prescription for Suboxone. If you can't get to your other appointments, say there is no appointments or you can't get to it, or maybe the appointment time is 10 a.m. and you have a job, come back to the emergency room. I would rather you come back and get another prescription for MAT or come back and get dosed here than going to the streets and looking for something and not making it through that night.
One of the main things that has really grown within our program is the substance use navigation consults, which our providers, our nurses are putting in for our patients with substance use. I go into their room and then talk to them about why they're there, what substances are they using, and if they're interested in starting that, having that conversation. When we're talking about rural areas, a lot of them don't know how to navigate the system.
My experience has been pretty positive with respect to prescribing Suboxone, and it is actually a little bit easier to do it. The fact that we have a substance abuse navigator in the hospital, it really is a conversation between you and the patient and the coordinator, shared decision-making type of model.
Our providers are able to see that, hey, this patient I saw 3 months ago, they're here because they don't feel well, but they haven't used in 3 months since the last time that we spoke to them, keep going. Those are the successes.
The people that come in these doors that need these MAT services, they're not just the people from the streets that are unsheltered. They're our neighbors, there are school teachers, they are the people that my kids play sports with. I think the biggest success is just reducing the stigma around substance use treatment and MAT services in our ED, with our ED staff, with our ED providers. The Adventist Health Bakersfield has really done a great job in handing out Narcan, letting people know that MAT is not a bad thing. Substance use treatment is not a bad thing.
When I met Mandy, there was just something about her that I trusted so much. I'm literally walking, talking proof that if you just give somebody a chance and you give them that medication, what it's intended for, it changed my life. I knew I could. I just need a little bit of help.